These look cool.
Yeah, that'd be great.
Yeah, I like it.
Steve, thanks for doing this.
Oh, thank you.
Hey,
Thanks.
Tim.
Appreciate it.
Good to see
Thanks.
you.
All right.
Awesome. All right. My name's Tim Cheatham, Director of Business Development at Pinnacle and Western Growers Health, and I'm really excited to be here with two leaders at this unique cross-section of health plan administration, health management, and agriculture. Today with me, I have Steve Brazeel. He's a current member of the Western Growers Association and CEO and founder of Sunterra, Elevated Foods, and Project FoodBox. Project FoodBox is known for providing access to nutritious food, fostering stronger, healthier communities. Thank you for being here.
Thank you for having me.
Also with us today is Steve Mangapit, Chief Operating Officer of Western Growers. As COO, Steve is focused on advancing and elevating operational efficiencies, improvements, and innovations throughout the Western Growers family companies. Steve also served as president of Pinnacle. Pinnacle Claims Management is Western Growers' wholly owned third-party administrator serving self-funded employers. Thanks for being here, Steve.
Happy to be here.
Really excited to be talking to you both about this new collaboration between Project FoodBox and Pinnacle Health Management. But before we get into that, I'd love to get some more background on you both and the organizations that you serve. So kicking it off with Steve Brazeel, tell me a bit about your background. What is Project FoodBox and how did it come to be?
Great. And again, thanks for having me. So I was born in Brazeel, California, the home of Western Growers, the original home, 99 years ago, I've come to learn. I grew up as the son of a farm labor contractor. My early life involved going out into the field, working alongside field workers, making sure that the crops that we were harvesting were delivered effectively to the shippers that were sending them out. And that gave me an early connection to fresh fruit and vegetable production and the challenges that accompany that. Very long hours. I knew that I wanted to be in the fresh fruit and vegetable industry, but also knew that I had other capabilities that grew outside of the labor management business, and so went off to school to study marketing around ag products and ended up working for several large multinational fresh fruit and vegetable companies, learning how to sell these products and get them out to the marketplace. And in 2000, I started a company called Sunterra Produce with the goal of partnering with growers that were smaller growers in the supply chain, aggregating their volume and enabling us to sell those products to large retailers, large food service distributors, wholesale distributors. And it gave me a real good idea of how product gets from field to end user. So in 2000, I started Sunterra Produce again and launched that and successfully grew that company over the years. And all of that changed for us when the pandemic hit in 2020. Our company was decimated. 70% of the crops that we grow are destined for the markets that were the most impacted during the pandemic. So schools, restaurants, hotels, the travel industry, you name it.
Everything that was shut down.
Everything that was shut down. Yeah. So when we had those 70% of our customers go away, then we were conversely disking up 70% of our crops, which was not sustainable for our business. And the USDA, in their wisdom during the pandemic, came up with this awesome program called the Farmers to Families Food Box Program. And that program entailed contracting with distributors like Sunterra to go out into the specialty crop industry and purchase fresh fruits and vegetables from farmers whose markets were similarly decimated, aggregate those into beautiful farm boxes, and then deliver those to food banks, faith-based charities, and other community-based organizations, of which we ended up working with 150 to 200 different organizations through that process. And it really forced us to think differently about production agriculture and the impact that one box of produce can have on an individual. So we all remember during the pandemic those long lines of cars with the trunks open and wonderful volunteers dropping a box of produce into those cars. Oh, yeah. And we were present at those events as part of our responsibility, and getting the chance to see the reaction that people that don't have normal access to fresh fruits and vegetables, whether it's through food deserts or extreme rural areas or underserved areas, and the positive impact that had. We knew right then and there that everything had changed for us and that this was something that we wanted to do. So during the course of that program, we were able to work with those multiple nonprofits to deliver 1.5 million boxes to communities all throughout southwestern USA, from the Navajo Nation to the Pacific Northwest, as far east as Texas, through our distribution facility. And that program lasted for a year, and then that program came to an end. And then a beautiful thing happened. Our community partners, namely food banks, came to us and said, we want to continue these programs. One food bank president eloquently put it to me that we were delivering front-of-life produce and they were used to getting end-of-life produce. And I hadn't really thought of it in that regard.
Yeah.
And so, they came to us after the program ended and said, how do we continue this? And because of the learnings we'd created during that program, how to source those hard-to-sell items from farmers, really being a valuable partner to a farmer to help get their entire crop harvested, we were able to develop a low-cost supply chain that enabled these food banks and community organizations to continue to access fresh fruits and vegetables.
I love that, like, necessity is the mother of invention,
Yes.
kind of learning, right?
Right.
That's cool.
Yeah, and so like that, and so that opportunity, food banks came to us, led by the California Association of Food Banks, which is a major organization that supports dozens of food banks here in California. We started working with them immediately after that program ended, and we're able to partner with several of their food banks, and just to kind of indicate how the program has grown and this awesome opportunity to highlight this public-private partnership. I mentioned the 1.5 million boxes we shipped during the pandemic. We recently crossed over 8 million boxes, just recently over the last couple of months, and that's been, really the indicator for us that these types of programs work. There's a need for fresh fruits and vegetables through those sorts of distribution channels, and it provided us an awesome opportunity to continue to work with farmers to, again, address that 30% of the crop that gets left in the field because it's too big or too small or misshapen. And so bringing real revenue to farmers for a part of their crop that they might not normally get, while at the same time helping our communities, seems like one of those really win-win situations, right?
Yeah, I mean, you're talking about filling a need in the community, supporting the agriculture community, supporting the economy, like keeping people working, like it's all really cool. I think the one thing I've learned from you and others in the agriculture industry is like you're all very humble and you take for granted this extraordinary talent that you have on developing partnerships and getting deals done and supply chain management. Like it's not simple.
Right.
You kind of just like, yeah, we just made partnerships and we got it done.
And we think that's, since that's what we do every day, we downplayed that as well, and we came to find out later on that was really the key to what we were doing, right? It's like, how do we get these boxes, how do we aggregate them, and how do we get them out quickly so that people can get products maybe more quickly than they would even from their neighborhood grocery store.
It's like it seems like there's parallels to like just farming in general too. It's like we did this, we learned something, we tweak it, we do it better. We just, because you're coming from such a low margin industry, you have to optimize, and then you've kind of like somehow you're competing on the level that you would think only like an Amazon could do with like door-to-door delivery.
Right, that constant iteration of learning. How do we drive down our cost? How do we invest in automation? How do we, make the jobs of the people that are harvesting, picking, packing, delivering easier to really streamline that supply chain? And it was really those attributes that led us into the healthcare business. So through innovative demonstration projects like the 1115 waiver, Medicaid waiver, that dozens of states are now participating in, where they're utilizing food as medicine concepts to help their members stay healthy. We were introduced to one managed care plan here in California because of those trusted relationships that we built with the nonprofit community and food banks. And again, it was because we were going over the top, delivering a type of produce that they never thought they could see or get on a regular basis, and making the delivery easy for them. And so, as to your point about the adaptability of fresh fruit and vegetable growers, when we met with our first plan, they said, "Can you pack a disease-specific fresh fruit and vegetable box?" We just said yes. When they said, "Can you interact with a healthcare plan and do all the billing and all the HIPAA compliancy that's necessary to do that?" We just said yes. And they said, "Do you have registered dietitians that can assess the members to help determine eligibility and provide the best food for them?" We just said yes. And then the kicker was, can you deliver it to their doorstep, directly to their doorstep? And again, we just said yes, because that's what produce people do. That's how you stay successful, is just saying yes and then creating the opportunities where you find them. And so we were
It's
able
like
to,
this, like,
yeah.
we'll say yes and we'll figure it out,
Yes,
right?
exactly.
It's this incredible confidence and belief in yourself and your team, and just like
to just get it done.
Just get it done.
To just get it done. And so the medically tailored meal landscape is traditionally dominated by frozen, ready-to-eat meal players that are embedded in the system and have been for decades.
Yeah.
These programs have existed in some shape or form all along the way. But we came to them with a more innovative solution that said, how about a box of fresh fruits and vegetables that can meet those person's needs? And the first reaction was, I don't think that that's possible, to your point
Right.
about like, how are you going to do this, and how is the product going to arrive in a fresh manner? And we just said, let us show you how we can do that. And so by utilizing the 30-year experience that we have in production, harvesting, purchasing, selling, we had these strong relationships with growers and the innate ability to determine which of those items that they're struggling to sell, whether it was due to market saturation. Mother Nature doesn't allow for your crops to just be harvested in a nice, easy manner. Sometimes it bunches them all together and then provides a gap later on, or maybe your cantaloupes are too big or they're too small, and that's not what the retailer wants. And so we really target those opportunities that have the best chance of impacting the grower's bottom line, and that's by kind of working in the hard to sell area.
So those growers the stuff that they can make good money on, you're not trying to buy that from them.
Exactly.
You're not saddling them with a contract
Right.
on that, right? They can
Right.
go sell it to the...
Right, and then similarly, when there are market opportunities, which come few and far between for fresh fruit and vegetable growers, and there's an excessively high market on a specific commodity, we don't touch that commodity. We let the grower, kind of take advantage of those opportunities that they have to stay in business. And then we say, call us back in a few weeks or a few months or a few days when your situation changes. And then us having the ability to react quickly and bring those items into the box. The beautiful thing about fresh fruits and vegetables is mostly all fresh fruits and vegetables are mostly good for mostly everybody. So these boxes are really more about the exceptions. Maybe there's some allergies, maybe there's some interaction with medicine that wouldn't allow for a specific fruit or vegetable to be appropriate for that. And so when you're talking about the full portfolio of fresh fruits and vegetables, especially how fortunate we are here in California and Arizona and the desert Southwest to really have access to a myriad of products, it made that job easier for us to kind of plant our flag here in California. So we were able to, take that first contract that we had, really work out what we were doing, understand the final mile delivery, understand how to contract and interact with healthcare plans, understand how to really embed that HIPAA compliancy from A to Z, which is not easy to do, especially for a fresh fruit and vegetable company. We realized that there was 58 counties in California, and each one of those has a separate managed care network, and that we were going to really have to work hard to educate each one of those plans on the possibilities. And I think, to our earlier point, fresh fruits and vegetables in a box were considered kind of the art of the possible. And then for our team, because of their tremendous ability to source, pack, and distribute, and the relationships that we've built over 20 years in business, really allowed for us to say we can do this in any county, in any area of California, based out of our facility.
Amazing.
And so that opportunity has led, similar to California, multiple other states have a similar demonstration waiver programs that are now starting to allow these produce prescriptions and kind of more fresh fruit and vegetable based interventions. And so those are states like New York and New Jersey that we're proud to move to and utilize those local growers and those local supply chains, as opposed to packing up a box in California and shipping it across the country to those areas.
It's almost like sacrilege to say it's easier to do something in California, but is it easier in California because so much of it is grown here?
Yeah, from a supply standpoint and a box ingredient standpoint, there's just such a wider array of fresh fruits and vegetables. But as we know, and as you know from working with Western growers, the fresh fruit and vegetable supply chain is extremely complex and it's extremely efficient. Whether you're in New York City or Pittsburgh or Miami or Columbus, Ohio, you can get a fresh salad at your restaurant every single day. And that's a testament to the growers and their ability to really work at lightning speed. And so the fresh fruit and vegetable industry works at that level of speed, which is often in contradiction to the healthcare system, which doesn't quite work at that same level of speed.
Oh yeah. Yeah, it's you're kind of putting some of these players in the healthcare space to shame in the speed of of business.
Yeah, we've often been called a disruptor, and I was like, what does that mean? They're like, well, because we're actively trying to push these things maybe faster than the system is set up to allow them to grow. But we've shown our ability to do this in multiple regions, and I think our country as a whole is recognizing the challenge that we have with chronic health disease, and then how we utilize fresh whole foods in those interventions, instead of the typical ready-to-eat meals, which are also a very valid and a very strong benefit in their own right. But what we find in the members that we serve is there's an overwhelming demand to get fresh fruits and vegetables as opposed to a prepared meal that they can pop in the microwave.
Yeah, I think I really appreciate what you're saying about, like, with a few exceptions here and there, like maybe with medicine interactions and allergies and things like that, most people can eat fruits and veggies. Like, if you think about, like, there's no label to read on what's the ingredients. It's all one thing, right? And I think what we talk about a lot from a health perspective is, like, especially with food, is like the shorter the list of ingredients is usually better, and you can't get a shorter list than here's an apple, right?
Exactly.
Great. I think the story of Project FoodBox is really interesting. I'm excited to get more into this collaboration between Project FoodBox and Pinnacle Health Management, these medically tailored meals. But before we get to that, I'd really want to pivot back to Steve Mangapit. If you could share a bit on your background as well as the foundation of Western Growers, Pinnacle, Western Growers Health. I'd love if you could share a bit more on that.
Yeah, I'm a little, I feel like I'm coming up short. Steve's running 3 companies between Project FoodBox, Sunterra, and Elevated, and I'm only running 2. We have, I run Western Growers Health, where I'm the Chief Operating Officer of not only Western Growers Health, but our parent organization, Western Growers, and I'm president of Pinnacle. My background, I'm not an agriculture guy. I am a healthcare guy. I'm just a guy. But I've been working in healthcare for about 20 years now, and more on the payer side of healthcare, so the insurance side. I started after grad school doing analytics and finance, and I've kind of had roles in finance, analytics, operations, sales, leadership. I came to work at Western Growers 2010, and actually was here on and off a few times, and then I came back 2022, so similar, coming out of the pandemic, came back as COO of Western Growers, and then subsequently took over as president of Pinnacle. So my role specifically as COO of Western Growers, I'm supporting all of our employees, and we have about coming up on 500 employees total for Western Growers and all of our subsidiaries, and supporting all of our members and all of our customers as COO. So I work very closely with our employees, our members, our clients. But the bulk of my work at Western Growers is running Western Growers Health and Pinnacle, where I'm the president. So a lot of healthcare operations. So Western Growers Health was born out of Western Growers in the 1950s. So like you said, Steve, Western Growers goes back to 1926, big 100th anniversary coming up next year. Started in Brawley, and I could spend an hour talking about all the things a Western Grower does, and you know a lot of it, you're on the board. But at the heart of what we're doing at Western Growers, we are supporting the agriculture industry, specifically California, Arizona, Colorado, and New Mexico. And what we do is we support our members where they want us to be supporting them, really. So in 1926, when we started, it was about supporting them in working with the railroads, right? That was a big deal in 1926. Fast forward to 2025, you probably can speak better to it than I can, Steve, but our members care about things like supply chain management, compliance, regulations, food safety, science, automation, labor, water, tariffs. Like, there's so much stuff going on. So I'd say over the 99 years, we continue to be where our members need us to be. Going back to 1957, where our members needed us to be was in employer-sponsored healthcare. And that's where Western Growers Health was formed. Very underserved market back then. I think the insurance companies didn't understand seasonal workers. They didn't necessarily want to be where we are in kind of rural parts of the country where food is grown. So we started Western Growers Health's first incarnation, which became Western Growers Assurance Trust. We recently rebranded as Western Growers Health, and we'll touch on that later. But Western Growers Health, we compete with insurance companies, but we are not an insurance company. So every dollar that comes into Western Growers Health on these employer-sponsored health plans is exclusively for the benefit of the members. So there is no profits going to shareholders or corporate dividends or anything like that. So every dollar coming in can only be used for the benefit of our membership. So that really informs our strategy on reinvestment and what we do as an organization to support people. So that continues to run today, and actually we're probably healthier financially as an organization than we've been in a long time. We started Pinnacle in the 1990s, and Pinnacle was born out of Western Growers Health when some of the larger employers needed to change the funding mechanism, and some of it was driven by the law. So Pinnacle was born as a third-party administrator serving large self-insured employer-sponsored health plans. So we picked up several customers coming out of Western Growers Health in the 90s that wanted to be fully self-insured. Pinnacle as a TPA was born. Since then, Pinnacle's nearly 30 years old now. We have expanded serving employers beyond agriculture. Agriculture is still one of our biggest verticals, but we have clients in really all industries, manufacturing, retail, hospitality, casinos, tribal, public agencies, schools, hospitals, you name it, anywhere where you'd see like a large employer. And that's our bread and butter at Pinnacle, is managing large self-insured health plans. But I think when I think about the TPA business and kind of back to the beginning of my career, in '96 I was still in high school, so I wasn't there at the beginning of Pinnacle. But going back to the earlier parts of my career, and certainly back in the '90s, when you think about a TPA managing a health plan, it was really more about transaction processing, paying claims, answering phone calls. We still do that today. That is kind of, we have a whole team of people, and we have a lot of automation around that. But the market has changed over the years, and now I think there's a demand and an expectation that as a TPA, we're not just a transaction processor, but we're helping bring value to our clients and their employees. And the value is in the form of getting people better health outcomes, better access to care, and bringing cost efficiency to the employers, so helping them manage their spend. They have fiduciary responsibilities on these plans, and their expectation is that from the client and their insurance brokers is that we're bringing that value. So that's where we've been putting a lot of effort and energy in. So Pinnacle, to meet that need over the years, we've added new services, new things, kind of similar to you. Like, we don't just build it and say we're good. We iterate and we evolve, and we kind of learn and understand where people need our support. So about 12 years ago, we recognized an inefficiency, and we started our own prescription benefit management program, Pinnacle RX Solutions. And so Pinnacle RX is serving as the prescription benefit manager for Western Growers Health, and then a whole lot of other clients of Pinnacle as well. We're helping drive efficiency into the prescription drug programs, which has really been escalating in healthcare spend over the last several years. And then one of the other big things we've done at Pinnacle is rolled out Pinnacle Health Management. That was also maybe 10, 15 years ago. And Pinnacle Health Management, we have a team of wellness coaches, health experts, nurses, clinicians. We have 4 near-site clinics where agriculture is. So we're in the business of not just being the insurance side and the payer. We actually now are in the care delivery side with physicians and nurses and doctors delivering care to people, health coaching, diabetes management, all the major disease states. We're helping people manage those conditions and trying to engage with them. And then what we're doing in that realm is we're really kind of moving beyond just condition management. So, it's really kind of clean and simple ROI. Someone has diabetes, for example. Let's do health coaching. Let's make sure you're managing your diet, your exercise, your medications, and getting into disease prevention. Preventing diabetes is a lot more effective than treating diabetes. I'm a kid of the 80s, really, and watching The Karate Kid, I remember like Mr. Miyagi was working with Daniel, and it's like, how do I block the punch? And it's like, the lesson wasn't how to block a punch, the lesson was don't be in the path of the swing, right? Like, so if we can take that philosophy, and anytime I can adopt the philosophy from The Karate Kid, I'm all in, right? If we can adopt that philosophy, how do we do health management and into prevention? That is going to have a better ROI in the long run, particularly for populations where we're going to be treating people for a long time, right? So that's kind of what we're doing, Tim, as you know, and we have a bunch of other cool stuff we're doing at Pinnacle. Tim and I are perpetually working with our teams on kind of similar to what you're doing. Where should we be? How should we be innovative? There's a lot going on in prescription drugs. There's a lot going on in care navigation and how do we improve health outcomes? How do we improve efficiency? But I think the thing that I get excited and passionate about is how do we improve engagement? And that's where I think this pilot we're doing with Project FoodBox and your team is particularly interesting to me, is not just the value of the produce, and the health outcomes it could achieve, but just the attention and the engagement and the differentiation that we can create. I'm looking for that kind of where you got the win-win with the suppliers and the communities. I'm looking for a similar win-win in terms of delivering value to plan participants and returning that to a savings for the employers. That's what we're all about. We've done a lot of different programs like that over the last couple of years. We've made our clinics free, no copay. We've made our panel of physicians and hospitals in Mexico no cost share. We coming out of COVID, everyone loved no cost share on telemedicine. We've continued that. We just certainly recently we introduced a program for generic prescription medications at no cost share at Walmart and Costco. It's along this kind of very similar lines, and that's why I think we have really good alignment. I can deliver value on one end and on the other end, where a lot of times the old ways of looking at things, it was more of a zero-sum game. It's like employer wants to save money, make the employee pay more. That feeds into a broken system. Right. So what we do is we look for that inefficiency where we can create the win-win, kind of similar to what you've been doing.
Exactly.
I think that's a great segue into this program between Pinnacle Health Management and Project FoodBox. So you mentioned Pinnacle serves Western growers' health in many ways. So one example being Pinnacle Health Management provides one-on-one coaching for Western growers' health members with diabetes, hypertension, hyperlipidemia. And this pilot program is providing medically tailored boxes targeting those members. Can you tell me a little bit more about the program, how exactly it works, how we're getting the boxes to the members and making sure that they fit their needs?
Sure, yeah, and so that's a great description of what you do, and admire the kind of the holistic coverage of how we're trying to impact individuals in every way that we can, whether it's engaging them through healthy food and pointing them towards other resources that would be beneficial to them. So we came to Steve and the group a year and a half ago now, I think, and we're sharing more about our program and how it was growing and how we were working with these Medicaid and Medicare plans and and our desire to enter the commercial market. And really was excited to learn that there was mutual excitement as we all represent growers that put food on our table.
Yeah.
And so as we work together, with their team and getting some direction on specifically what we were looking for, whether it was actually driving down cost of care, whether it was engaging more with the members so that you have a clearer pipeline to communicate with them, whether it's working in your clinics that you've created. The opportunity, Tim, was really to how do we customize a program that fits the needs of a commercial payer as opposed to a Medicaid or Medicare player? And so through numerous conversations and numerous kind of iterations of the program, we developed this program to really focus on some specific populations within your plans to make sure that we were helping them adhere to a lot of the things that would make them healthier. So in terms of like the nuts and bolts of it, it's really not different than anything else that we do with any of our other plans. It's working with members, assessing their needs through a nutritional assessment, building out a box that would be beneficial to them, taking into account those chronic health conditions and other factors, and then partnering with Western Growers Health to identify those populations and get those boxes delivered directly to their door in a very quick manner and a very fresh manner. And
Sounds easy.
yeah, and that's really been led by the Western Growers teams in terms of like what outcomes that they were looking for and what we can do as a partner. Kind of along my earlier when we just say yes to things, it was a similar thought process. Like, what do you need? How can we benefit it? What do you want the box to look like? How often do you want it delivered? What types of items do you think are critical to go in there? And how can we best partner? As we see it as somebody with immense experience in the fresh fruit and vegetable supply chain and less experience navigating the nuances and complexities of healthcare, we look to our partners to help us understand that and then help us build a product that's most appropriate for them. So we're real excited to launch this and to start developing that first cohort and getting those boxes out to those folks.
Yeah, it's funny because there's very few people in the world that are working in agriculture and healthcare, and you're doing it from one end, and I'm doing it from the other end, and we have this like kind of intersection. And I know I'm learning a ton from you, and we're trying to share what we know with you and your team. It's really fascinating. I think about I remember some of our very first conversations. I was really interested. Like most people, I was kind of skeptical about this last mile delivery thing. But we've learned that you can achieve the impossible. But I think about like I think it was a conversation we had. We were talking about food as medicine, and I know in our space when you start talking about things as medicine, then you start talking about prove it, and what's the ROI. And I almost see this more as like not just food as medicine, but food as engagement. And now apparently the new term of art is food as health, right? So
food
we have
for health. Yeah.
food as medicine, food as engagement, and food for health, right? I think all three is great.
Depending on what outcome you're looking for, right? I mean,
Right.
like certain organizations are looking for direct impact on cost of care. Tons of studies come out, and most recently from the Department of Healthcare Services, showing a 20+% reduction in ER visits and hospitalizations. Other studies from prestigious organizations like Tufts showing, what the cost of care, how that would be impacted through these different opportunities. So it's how do we take this building, this ever-growing business case around like how do we utilize healthy food to engage members more effectively.
And we have, I think particularly in Western Growers Health, we have pretty big populations in the pool that are more lower income that are going to have a lot of commonality with the Medicaid populations that you serve. But then we also in Pinnacle have more high-end populations, like higher wage employees. So I think on one end, we're talking about food insecurity and kind of solving that gap. And then on the other end, we're probably talking about the migration away from ultra-processed into more fresh produce. So I think the lesson I've learned is it's not about just getting people food where they can't afford it or they don't have access to it. It's about getting it in front of people, because fruits and veggies are just better for everybody. Any walk of life, this is better for you, and if you get it in front of them, they're more likely to eat it. From an engagement perspective, I've been telling people, like, the days of an email with an Amazon gift card are dead. There's too much digital noise out there, but if I drop a box of broccoli on your doorstep, you're not going to be able to ignore me, right? So I do think this is going to drive engagement. It's also going to kind of connect the whole family, I think. I really think there's something there. Like, you know, I had a box of fresh produce at my house, and my kids are like, "What's this?" And I'm like, "Let's open it up. Let's take a look at it."
Do
It's
the
like,
unboxing.
yeah. It's like that Ryan's Toys thing, you know? It's like, "Ooh, what's this?" And we had tomatillos, and my kid had never seen a tomatillo before. I'm like, oh, let's learn something. Let's figure out what we can cook with this. So there's a family experience
Yes.
there, and engaging with fresh produce is really exciting for kids, right?
Yeah, so we've along those same lines of like how we build the programs. You know, early on we also figured out that if you just drop a box of fresh fruits and vegetables on somebody's doorstep and nothing else, that's great. But, you know, I'll use the example of artichokes. One of our growers had an overabundance of artichokes and said, "Can we put artichokes in the box?" And my first reaction was yes, but we need to put 14
can't
ways
just eat it, right?
We need to put 14 recipes in there that show what they can do, you know, what they can do with that artichoke. And everybody has a smartphone, or most people do, and can access those sorts of things. But the education that Western Growers is putting in their box is similar to some of the educational components that we put in our box too, which is it's more about, it's not just being able to stop and drop a box and move on down to the next one. It's about how do you create a connectivity to what the items in the box? How do you allow for them to understand all of the different ways they can prepare those fruits and vegetables that are in alignment with their palate, with their culture, with however they like to enjoy their food,
Yeah.
to get full utilization out of the box? Because at the end of the day, we don't want them going, "I don't want the spinach, I don't want the broccoli, ooh, there's some peaches in there and a melon in there, that's great." It's like, how do you tie all those components together to get people to enjoy and to maybe stretch their mindset in terms of like what they can do with fresh fruits and vegetables. And when confronted with the sometimes often high price of items at the store, I'll utilize cauliflower. You know, like my wife likes to integrate cauliflower in a lot of unique ways into my food, whether it's the cauliflower mashed potatoes or these sorts of things. And
Yeah.
when she cooks me these beautiful meals, I always say, what did you do? What's healthy? Like, what did you try to sneak in here or something?
Right.
And we always get into discussions about that. But it's that same thing. It's how do you like how do you demystify produce? How do you a person might not pay the $7 a head for what the cauliflower is going to cost, but now that they learn how to make it and go, oh, this is a nice substitute or addition to things I'm already eating, now that person becomes a cauliflower customer at the grocery store, and it just broadens. We found that it's broadened their horizons. We get a tremendous amount of feedback, both online and through our call centers. That, I mean, there's hundreds of comments a week that we get that are, to your point, we were able to make this wonderful soup and my whole family was able to enjoy it. We use 6 different of your items all into one soup.
Yeah.
And then getting back to my wife and us at home, we get a box every week too, because I want to, for quality control purposes, and I want to see kind of what's in there. And she's always really happy to say, like, there's 4 PFB, Project FoodBox items in our dinner tonight, in our salad: the lettuce, the tomatoes, the onion, and then for dessert we have this, that, or the other. So
Yeah.
I think it kind of makes it a fun experience to be able to get this kind of surprise box of items that you're going to get. And for us, it's really critical to not have the same box over and over again. Early on in the food banks, kind of a quick aside, they asked if we were just going to include what they call the hard 7, which were typically the items that food banks bought. So think onions, potatoes, sweet potatoes, apples, oranges, kind of like the very non-perishable, kind of, I don't want to say boring, those are very great items. But like for us, it's about like, how do we put exciting items in there, something different? How do we get blueberries in there? How do we get strawberries in there?
Yeah.
How do we get tomatillos in there? How do we get jalapeno peppers in there? How do we get some different things so it's not this redundant box that they get every week? It's a new, unique eating experience every time they open the box.
I love that. And this is the one thing my wife is excited about me bringing my work home with me, right? What we've been doing is I have a juicer, and with the kids, it's like, let's throw it in the juicer and see what happens.
See what we got.
But you got to get the fiber too, right?
Right.
I know that that's a whole nother health issue.
And then through the registered dietitians, before we send out any box, we meet with our team of registered dietitians who actually inform our procurement team on what items are going to meet. Some of these programs are very specific. They need to meet specific health requirements that are outlined by various state agencies. And so it's this puzzle piece every day, every week of us putting the right items that, when combined together, check the boxes to make sure all of those attributes are met.
And I know, you know this, but I know from talking to some growers and things like that, anything that is going to increase demand or create new demand for fresh produce is like, oh yeah, let's do this, right? So it's really,
which makes it in alignment really with the Western Growers Mission.
It's really
as
easy for me to
fresh
kind
fruits
of
and veggies.
it's really easy for me to look at this and be like, yeah, this is really good. This fits into this is a lot easier sell for me than trying to introduce a carnivore diet or something like that, which also is not a smart health move.
And I think the timing of this partnership has been really great too, right? Western Growers Assurance Trust recently rebranded to Western Growers Health, really exemplifying this focus on employee wellness and focusing on the health of the members that we serve. So Steve Mangapit, can you tell me a little bit on what does that rebrand mean to you? How does it exemplify a focus on employee health and wellness? And what is this partnership with Project FoodBox? How does it really tie it all together?
Yeah, so it was kind of an interesting identity crisis for us, because we have the Western Growers name has a lot of brand equity, particularly with agriculture companies and employers. But the original name, Western Growers Assurance Trust, which is still our legal name, sounds like a bank to me.
Yeah.
And it doesn't evoke a modern approach to healthcare. And we spent a lot of time looking at that, our team. And really, we've been doing so much great work in the last several years. And I think I was trying to find a way to kind of show, branding is not about changing names and logos. Branding is about your identity and the way that you want to be perceived, and kind of showcasing your values. So we really kind of are all in on health, right? And health of the employees, the financial health of the ag companies, and the alignment of that, the physical, mental health, that's really what we were after, and we're trying to keep it simple, while keeping the connection to Western growers. That's our heart and soul. So our rebrand is kind of like a very simplified version of our evolution to health, and with a very strong connection to the existing organization that's been around for 100 years. So, I think that's really kind of what we were trying to do with the rebranding, and I've been we got a lot of good feedback from the marketplace. It's interesting. We have a lot of your family coming from farm labor. We have a lot of population that is primarily Spanish speaking, as you can imagine, with this type of population that's working for agriculture companies. And I've been doing a lot of research and investment in understanding the members that we're serving, because we talk a lot about the employers, and those are the buyers that are making buying decisions about the healthcare. But when we talk about engagement, we're talking about the participants, the employees, and we spent a lot of time trying to put ourselves in their shoes. Culturally appropriate communications and care and all those things. It's funny because our branding to them, they don't call it Western Growers Assurance Trust. They call it La Western. This is La Western. And I'm like, we should be leaning into that. This is already the way we're known. So we're playing around with kind of this quasi offshoot identity, kind of meeting people where they are. And these flyers, I believe what we're doing, and you can confirm this, Tim, but what we're trying to do is look at this and I think as we're registering people, like what language they want it in, and I think a lot of these boxes are going to show up with the pamphlets in Spanish, and the boxes we have are kind of dual language. Really trying to understand how we're going to the conversation we have a lot from a marketing communications perspective is, this looks really cool, but who's the audience we're communicating with, and how do we speak to them in the way that they want it? It's the old golden rule versus the platinum rule. Like, treat people like they want to be treated, not like you want to be treated. I think we're really kind of gathering some insights and being more effective on that front nowadays.
That was one of the other things that we had to say yes to when we were working to engage in our first contract, which the first plan that we were contracted with required us to be proficient in 8 different languages.
Oh, yeah.
And so that was one of those ones I said yes to. Then I was like, wow, how am I going to do this? And then come to find out, so we've the majority of our RDNs are bilingual English-Spanish, and then we've added capabilities around all the other languages as well. And there's some technologies that you can, some translation technologies that you can leverage to be able to help you do that. But that's been a critical component of how we've done the program. Again, to your point of putting these foods that are culturally relevant to the people who are receiving them, and making them, again, kind of, making that box less intimidating by having items that they're comfortable cooking in, and then providing them with the resources in any language that they desire. And since that initial plan, I think we're up to something like 25 languages between all the different plans that we're contracted with, that we're required to be able to be competent in. So that's a great point along those lines.
I have a similar story. I said yes to something a couple of years ago, and I handed it off to my team here off camera, and I'm like, we have to do webinars simulcast in 6 languages. Can you, I already said yes. Can you guys figure that out? And they figured it out, and now it's like no big deal.
Right, you just do it, and then your team sounds similar to mine. I love being able to go out and create any program with any healthcare company and be able to say yes, knowing that I have the team that's going to execute it and that's not going to question it. They're not going to tell me the reasons why they can't do it. They're going to find the solution of how they can do it.
I think we're getting into like management philosophy conversation more, but I think about like shifting the mindset of saying no. People say no because, and we change it to yes if, and then we just tackle what's on the other side of that if, right? That's kind of a more, and I like to think my team looks at this stuff from me as like, Steve really believes in us and he's confident we can get it done.
Empowers them.
Yeah, as opposed to Steve's got another crazy thing he promised someone that I have to go figure out, right?
There's probably some of that too.
But it's exciting, right, Tim?
Yeah, it's fun. It keeps us on our toes.
Yeah.
I really want to pivot a little bit towards Pinnacle. Pinnacle largely is serving self-funded employers that have real skin in the game with their health plan, and they're financially incentivized to take care of their employees' health. Why would a program like Project FoodBox make sense for a self-funded employer or a broker that's looking to move the needle on the health of their employees?
It's a good question. I think the choice is theirs, right? The way I like to think about it is I would start with, look at your population. What's your average tenure? How long is this person going to be working for you? And there's a lot of great companies out there that have people that work there for 20, 30 years. And if you're a self-insured plan, that 20-year-old you just hired, you're going to be paying their medical bills for the next 30 years. Why wouldn't you want to invest in their health, right? It seems like a pretty straight line ROI. Like you don't want this guy to have a heart attack just from a purely financial perspective, unemotional. Like you don't want to be paying for that hospitalization whenever it happens, right? So I think that's part of it, but I also think it's about employee engagement. And when I talk to large employers and their insurance brokers, a lot of them talk about save money, but the other end of it is we have to have valuable benefits, right? And we have to have employee engagement and retention, right? There's plenty of industries out there that are very competitive for talent, and benefits is a big part of that competition for talent. So having a well-run benefit program transforms the conversation of this is just a cost that we have to incur to this is a value that we're creating to give to our employees. And I think if you can win that mind share, you're going to have better outcomes. There's also this kind of virtuous cycle that I talk about, right? And have you ever heard of virtuous cycles?
Yeah, we shared that.
Yeah,
so
it's the opposite of a vicious cycle. Vicious cycle, most people are aware of. It's one bad thing leads to another bad thing, leads to another bad thing, and this like snowballing effect, right? The virtuous cycle is the opposite. So one good thing can lead to another good thing, can lead to another good thing. So I think programs like this, if we can insert some positivity into this cycle and improve health outcomes or engagement, what happens is I can improve, if let's say I can improve the health of employees, or I can reduce the severity of disease states, people get healthier, it reduces absenteeism, it improves productivity and performance at work. Better physical health has a direct impact on people's mental health. So there's direct line to mental health, which ties into performance. They're going to be happier, healthier at home. They'll be happier, healthier at work. Reducing the severity of the cost of the medical expenses for the employer translates into lower costs for the employer. It typically translates into lower out-of-pocket, lower co-pays, deductibles, things like that. But when that employer is saving money on their health plan, as they renew, and every benefit cycle, you typically, even on a self-insured plan, you're going to renew with your stop-loss insurance and things like that. Better performance of that health plan is going to create lower medical trend. And when you have lower trend on expenses going up, which today, I think the average is like 9 to 10% on medical trend. It's crazy.
Unsustainable.
That allows the employer to do different things with that money, right? And they can avoid tough decisions about like reducing workforce or making the employees pay more for their health care. So if they are not having to have the employee participate in cost increases, that will put more money in the employee's pocket. That is going to feed back into this whole cycle of less stress, better health outcomes, and then this cycle can kind of feed upon itself into creating better outcomes, right? That's how I would describe how we would want to talk about the considerations here. There's certainly an element, and this as well, Tim, of just like, this is something you learn when you're a little kid. Like apples and veggies are good for you. Like,
an apple a day keeps the doctor away.
Yeah.
You are what you eat.
You
it's
are
all
what
these
you
things
eat.
that we've learned 30 years
So
ago
let's-
that are coming
let's,
back to.
yeah, what's old is new again, right?
Yes. Yeah.
Yeah. You don't want to be dealing with medical bills. Like, invest in celery and cauliflower, right? That's going to be the right place to be looking at the future.
I know we hit a little bit earlier on food is medicine, food is health. I know at Western Growers, we often say that our members grow the best medicine in the world. Mm-hmm. Steve Brazeel, can you tell me a little bit about what food is medicine or food is health means to you?
Yeah. And so I love that tagline, and I know that Western Growers has had that. They were ahead of the curve with that tagline. It's been several years kind of before this food is medicine movement has really climbed up. And I think, as we're seeing some new trends in government, whether it's the Make America Healthy Again report that was just dropped, that if you look at that, is littered with comments around whole healthy foods and taking a look at ultra processed foods and how they're impacting our society. I mean, when we look at these programs, we really just, again, like we maybe look at it from a different lens because of our deep knowledge in agriculture and the fresh fruit and vegetable industry. Is just seeing this awesome opportunity to tie agriculture and specialty crops particularly directly into this movement and creating this new market opportunity that literally didn't exist before. As growers, we're all looking for new customers and new people to sell our products to. But we were chatting kind of offline earlier today about there's actually conferences being held about whether it should be food is medicine or food as medicine. I mean, it's getting down to that kind of level of defining, like what it is we're talking about. And then the Maha report referred to food for health, which I thought was really good too. And so I think it's this overall like concept again of what we just spoke about what you put into your body is going to affect your long-term health. And so, as we started getting deeper, once we kind of got over the initial hurdle of how are we going to pull this off, how are we going to get a beautiful box of produce delivered to someone's door, our focus immediately went to how do we prove, and I don't want to use a term like return on investment because that seems, kind of crude when you're talking about someone's healthcare, but how do you build the business case or how do you build the case to show that these interventions over time are going to create wins across the board, healthier people, which is first and foremost, and then creating an effective and efficient and a cost neutral or cost savings benefit, through the actual, delivering of this benefit. So I think that the opportunities are massive for these types of programs to continue as we look towards the expense, GLP-1 drugs are top of mind that a lot of people talk about. And if you look at the reimbursement rate that it costs the healthcare system to reimburse for a GLP-1 shot versus a box of healthy fresh fruits and vegetables, it would shock you how much less expensive it is to actually provide healthy food that might allow for someone to not need to get on one of those drugs or a way to taper off of those sorts of drugs in the future and going forward. And then so I love this connection to food is health, food for health, as opposed to food is medicine, even though that's kind of the industry standard that we're going by or the industry jargon that's being used. But it's really this this old concept that is new again, which is how about we take a look at what we've been putting into our bodies and how do we create these opportunities to drive down the cost of care while obviously improving the health of the recipient who's getting the box.
I feel like in my own personal health journey, they always said diet and exercise. I kind of, the thing that I think I've learned is it's diet and diet and diet and diet and diet and exercise, right? It's all about what you're putting in.
Right.
That's been the big difference maker for me and what I've seen.
And I love that the evidence is starting to come out with these studies, and if these studies take years, and that's, we were talking about earlier how we like to operate at lightning speed, and someone says we're going to start this report, we should have the answers in 2028. I'm like, these should be very easy concepts to understand. I don't think anybody out there would dispute that healthy fresh fruits and vegetables and healthy food in general are going to drive those outcomes. And so, as we think about government-sponsored healthcare plans, Medicare, Medicaid, and this leap that Western Growers Health is making, which I think is awesome, and I think it's really, it has a lot of foresight for your organization to really think about these employees, to your point, that are going to be on your team for 5, 10, 15, 20 years. How do we get them on the trajectory of staying healthy so that we don't run into that problem when they're at year 25? Of their employment with an organization.
Yeah, and I just think about like the employer. I think about like, my own frame of reference. Like if I'm sitting at home with my wife, and we're talking about my job and my employer, and it's like, you can't go work. You might be able to go get more money somewhere else, but this company actually cares about you, right? That's powerful connection, right? I think there's something there too.
Yeah, there's this, I haven't looked at any kind of polling numbers, but it would make sense to me that a lot of people probably don't have the most high opinion of their insurance company in a lot of respects.
No.
And so, like, what an opportunity for an insurance company or an insurance provider to show that they care about their member, than providing them with healthy foods and to let them know that, hey, these guys are on my team, they're on my side, they're in it for me and helping us get healthier, and how do we work together to achieve that goal.
And there's not like a lot of like gotchas or ulterior motives with a head of cauliflower showing up at your house, right? It's like, oh, they're gonna, it's just a head of cauliflower. It's like,
yeah, I don't think anyone's gonna go, I can't believe they sent me a box of healthy food.
I know, what a jerk, right?
yeah, I mean, like, and then so those are parts of studies that I really would like to dig into, which is like the like, are you happier? Like you mentioned mental health earlier, and so like, undoubtedly from the tens of thousands of people that we've delivered these boxes to, the response is indicating that they're very happy, and then that happiness can lead to them like leaning more into their health. We had a roundtable with Congressman Raul Ruiz a few weeks ago at our facility in Brazeel, and we put together a really nice table. We had farmers there, we had social services directors there, we had county elected officials, we had insurance companies, and we had a couple of members who had received the box that I thought was critical to get there. And one of them talked about their journey of losing 50 pounds once they started getting this box and we said, why? Because that's pretty, in a 24-week period, that's pretty impressive. Like, wow, and they said, well, no, what it did was we opened that box, just like you mentioned earlier, and it was like an excitement. Then they got their phone out and used the handouts that we gave them and said, what are the awesome things we can make with that? It changed their entire mindset of how they thought about food, where before they may have just ran out and got some fast food or went to a restaurant, and it just made them think for a moment and contemplate it. Then they started seeing results, and then they leaned into it, and since then they've been buying fresh fruits and vegetables every week at the store to integrate into their diet, because this was the head start that they needed, and they were able to see really good results. Another program that we partnered in with the University of California, Irvine, we provided a similar program where there was some, but again, the education is so important. They would bring in this group of people, we would send the box of what the members were going to get, they would open it up, they would cook, there was a cooking demonstration of like all the different things they could do with it, then they'd send them home with the box. In a 10-week period, the A1C dropped from 8.5 to 7.5. And those are tremendous, results in just a really short period of time. And so, like, how do we, continue to work with healthcare systems to again, a lot of big organizations are working on these studies and all these outcomes, but I think they're all gonna lead to the answer that we know going in what's going to happen when you change the mentality of how people are eating and how they can access fresh fruits and vegetables.
I like that. Maybe we should do that, Tim. Like, not only like showing, like when we do a lot of health fairs and like open enrollment events, not only just having the food boxes there, but maybe I could get a chef's hat and do some cooking demos, right? Right. That'd be fun. Because
like somebody that, when they would get the box, they might not make the leap to go, oh, look at all the different items I'm getting. Like, what is a dish that would complement all of those? I mean, an apple, everyone knows what to do with an apple, but like when you have the cauliflower and the celery and the lettuce and the Persian cucumbers and all the different things, like how do you integrate that into something cool to make that box less intimidating?
Yeah, I love it. One of the other like big data points that I saw that was really informative for me. So I'm an insurance nerd, right? And whenever we look at like programs and point, like we call them point solutions and things like that for a self-insured plan, everybody promises we're going to save you money, right? So for me, the real litmus test is, what does the reinsurance carrier say? Mm-hmm. If because they're ultimately holding the bag on the big catastrophic hospital bills, what do they say? Do they believe in this program? And they usually are looking at things like cancers and hemophilias and preemie babies and like genetic drugs and like high cost stuff, right? But the emerging thing now, I saw this in a report recently. The first time I think we as an industry are seeing the people on the finance side saying lifestyle is driving cost and that needs to change, right? So it's a new acknowledgement that prevention has to be part of the solution on this unsustainable trend of cost increases in healthcare. To me is like a big flag going up and waving around that we have to attack this problem on the prevention side, and I'm a believer in that, and kind of like I want to lean in and kind of be part of the solution instead of being part of the problem, right? Because I'm not going to name any names, but the big bad insurance companies, they're like, well, let's just cut costs to appease shareholders and let's deny things and use AI and all that stuff, and that's not really tackling the root cause, right?
Being proactive instead of reactive.
Yeah, and like saving money. The beginning of the story should be how do we get people healthier on the front end, not how do we reduce the cost of treating them, right?
I'd love to, we're getting closer to wrapping up here, and I'd love to kind of zoom out a bit and focus on healthcare at large. Clearly, it's an industry that's rapidly changing, whether it's regulation, cost containment strategy. But from this conversation, I've really gathered there's a strong commitment to health from you both, as well as the organizations you serve, Project FoodBox, Pinnacle, Western Growers Health. So if you could share a little bit, each of you, on what that commitment to health means to you, and how does it guide you in navigating this industry that's constantly changing?
Want to go first?
I think about this on a daily basis, and I challenge my strategic leadership team to think about how do we look at where we want to be in the future. It's the old be where the ball is going to be, not where it's at right now kind of approach. We have to figure out how to incorporate a health forward mindset internally, but I think the harder part of it is working with our clients and with the plan participants and getting them engaged on this approach, right? And that is really, there are a lot of great employers out there, and we work with many of them, but I think the kind of the country at large needs to be more engaged, and I'm all about trying to help change the conversation and drive progress on that front. But it takes my kind of mindset is it takes a village, and I think it's let's create small wins here and let's lead by example. But I think solving the problem at large is going to require everybody to be involved.
Yeah, I agree with those points, and I think for us as we look towards what the future of food for health, food as medicine, food as medicine, all the different, and I'm learning my acronyms too. When you work in healthcare, you learn about all these, SDOH, social determinants of health, health-related social needs, all these different ones that I'm really learning. And for me, it's these Medicaid demonstration waivers are a phenomenal way to get the ball rolling, but they are what they are. They're pilot programs, multi-year pilot programs, and then with the goal of proving the outcomes. How do we get to the point where, my goal in several years would be to be able to walk into any insurance company, whether it's Medicaid, Medicare, or commercial, and say, we're here to make your members healthier and save you money. And if we can get to that point, then it doesn't make any sense for it to not happen. And then so what needs to happen for that to happen? Produce prescriptions are another description of what we do. Those need to be embedded into healthcare, whether that's through codes or through other mechanisms. The government needs to indicate that those are going to be covered benefits.
Right.
And typically when Medicare and Medicaid and government-sponsored insurance programs adopt certain methodologies,
the world will
commercial follows.
Yeah.
And so again, I want to tip my hat to Western growers for kind of sticking their neck out first and saying we believe in this and we think this is something that makes sense for us and for our members and for many different reasons. And so I think that commercial insurance aspect is going to be the toughest nut to crack, because a lot of these folks are going to want to say, tell me where that's going to affect my bottom line, right? So how do we continue to refine these programs, continue to say yes, to say, hey, what exactly are you looking for, to get them more as an accepted, embedded, everyday process that's non-controversial, that has its specific code, that has its the ability for a doctor or a primary care physician or a community clinic or a hospital to be able to prescribe this as a benefit.
Great. My last question for the day is going to be, is there anything that I should be asking either of you that I haven't asked yet? Anything you're burning to discuss?
Yeah, well, I think I find it interesting, and Steve nailed it on the head when he's like, no, let's talk about how you actually do this. The first year we were doing this, when we would pitch different managed care plans and talk to them about what we were doing, we would kind of gloss over that whole supply chain part and really, thinking that because we didn't know, enough about healthcare as we do now. And so we were really just trying to get them comfortable to contract with us, and to a person and to an organization, they're like, wait a minute, let's talk about how are you going to get that box of produce delivered to somebody's door that's still fresh. And
right.
And then so I find it I find it very interesting, and I'm proud of it, that it turns out that our ability to work very closely with these multi-generational family farms because we have the trust of working with them for 20 plus years and being a Western Growers card carrying member since day one of our company, to be able to like make the hard part easy. But really, you know, I would be remiss if I didn't mention like the tremendous challenges and that we have found a way to excel at. You know, I like to say when the program hit us, the first Farmers to Families FoodBox program hit us, we came to find out that we were uniquely qualified to be able to do this, and I wouldn't have known that before we won that opportunity. But the way our team was able to mobilize, the way that the grower, packer, shippers that we work with got it, understand it. They enjoy selling produce to us because it makes them feel good. We might not be their biggest customer, and we certainly aren't, but it's one that makes them feel good to sell, to be part of. So the strength of the fresh fruit and vegetable supply chain was undoubted even through the pandemic and the following years after that. So I think it's, you know, I want to tip my hat to our team and all of the growers that we work with that work together to make sure that the produce that ends up in the box, that ends up on your member's door or any other member's door that we get blows their mind. And I always tell my team, there should be nothing in that box that you wouldn't buy at the grocery store with your own money, or that I wouldn't buy at the grocery store with my own money. This isn't an ugly fruit program. This isn't a program of how we're going to try to, you know, take some old produce and stick it in a box. This is a way to work with growers to help them get rid of the crop that they're going to harvest today or next week or in the future, and be able to, because the opportunity would be missed if the product was subpar at the end of the day. All this stuff we've been talking about is great. If the produce comes rotten to the door, the whole thing's
dead on arrival, yeah.
And so, yeah, I think, you know, I wanted to kind of talk about that a little bit because it's what I've done my entire life. I tend to kind of downplay it, but I think that's really the critical piece that's allowed us to be successful, is the fact that we have such tremendous member satisfaction and excitement around what we're delivering every week.
If there's one call to action or one takeaway that you'd like the listeners to take from today, what would it be?
Well, I would love to know who's listening, but I think the answer to that question probably is dependent on the audience, right? So when I'm speaking to audiences, we're talking about employers, we're talking about insurance brokers, or we're talking about like plan participants, and maybe my mom's listening too. I don't know. So insurance brokers, I think the call to action is look at this solution to put in your bag of tricks when you're consulting with your clients. This is where the industry is headed. It's one of the frontiers. So being at the forefront of that is going to make you a better broker, better consultant. And talk to, you know, if you're talking to your agriculture book of business, talk to Western Growers Health and our team there. And if you're talking to a large self-insured employer prospect or client, you know, take a look at Pinnacle and our team. And I think we'll find a way to kind of share our contact information and all that. For employers, I think this is something that you should look into and see if your health plan is providing. And I think kind of at large, and I think this is kind of in your wheelhouse, Steve, but like just in general, like look at incorporating more fresh produce into your diet, into your life, into what your it's in your fridge and on your tables for your family. I think that's, you know, I'd love to bring in more business and more customers and kind of and get this thing going. But in general, like get the word out on. It's kind of funny because this is not like a new thing. Like I don't think we're breaking any ground here by telling people that eating fruits and veggies is good for them. But like finding a way to make it happen and believing that it's possible is what I would want people to get out of this.
Yeah. What my takeaways would be, you know, for healthcare plans and would be to, again, not see this as so difficult to achieve logistically that it's the art of the possible. Like that would be great, but I mean, realistically, how is somebody actually going to get a box of fruits and vegetables delivered effectively to a member, and to let them know that it's happening every day, and that that is, you know, a program that we've been able to execute at scale, and others would similarly be able to. As far as the individuals receiving the boxes, I really think this is a great opportunity to not only increase your access, increase your consumption of fresh fruits and vegetables, but get a chance to know who it is that grows your food. That's one of the things I didn't mention too. In some of the boxes that we send out, we put a little card in there that talks about the grower who grew that celery, that grew that cauliflower, that grew those apples. And I think when people have a tighter connection to the families that are actually producing that food, it provides that opportunity for them to really get excited about that product that they're buying is making a positive impact on that farm. And I think over time we've kind of lost that connection between who the individuals are that feed us every single day. And these programs like this have the opportunity to shine a light on the awesome fresh fruit and vegetable producers that keep us fed with healthy food every single day, no matter where you're located in the U.S.
Yeah, well said. And we've hit on this theme a couple times today, this whole idea of saying yes. Sometimes on our side with Western Growers Health, it manifests in, let's just try stuff, right? Which is along the same lines. What I'm really proud of is we've tried a bunch of stuff in the last 4 years, and some of it's worked, some of it hasn't worked. But what we've found is on the stuff that's been working, it's making a difference. So the trust has grown. I think last year we grew 9%, which is like really great spot to be. It's not too fast, but it's very robust and healthy growth. And we have the thing I'm most proud of. A lot of what we do is very price sensitive in this marketplace, and over 80% of our customers got a rate increase of less than 3.5%. 80%, and this is in a world where the average is 9 to 10%. And we are so what we're doing is working, and I'm really excited about doing this with you guys, trying this, and I'd love to see what else we can do together. And I'm excited to when I think about like the end of my career, and I got a ways to go, but if you guys have been successful in kind of helping being part of a world that's migrating to a healthier America, a healthier world, in delivering fresh produce to people and just changing the way we eat and changing the way we're being healthy. If I can look back and say like, yeah, we were a very small part of that, kind of on the earlier end of it, that's something I could be really proud of. So I'm excited to do this with you and your team, and I'm really interested in seeing how this all plays out.
Yeah, and thank you for having the courage to take the opportunity, and I know this is something you had to work with all of your organization to kind of get excited about, and we are going to work our rear ends off to make sure we get it done in a proper fashion.
Cool.
Great.
Thanks, man.
Yeah.
Thank you so much. Steve Brazeel, Steve Mangapit, thank you both for your time.
All right.
Thanks.